Hello, my name is Ireland, and this is for my show off number 9 for Wernicke's aphasia. So, first question, what is it? It is an impaired language comprehension. The most common cause of Wernicke's aphasia is an ischemic stroke affecting the posterior temporal lobe of the dominant hemisphere. Aphasia is categorized as either an expressive, which is Broca's, or receptive, which is Wernicke's aphasia. We're going to be looking at Wernicke's aphasia. So first, we want to look at what's affected. So their comprehension is affected and repetition is affected. So patients with Wernicke's aphasia have impaired comprehension of their speech and thus do not recognize the errors that they're making. So I know probably a lot of people have watched this video about Wernicke's aphasia. I think his name is Byron. Anyways, so when he's talking, he completely understands what he's saying and he thinks it's making complete sense, but on the other person's end, it does not make any sense at all. I think there was one part where they're like, "Oh, like how are you?" Or like, "Hi, like how's it going?" And he was like, "Good. You look or you pretty. How today is?" I mean, it was just kind of all out of order and didn't make any sense. And um, just not the correct um, words that are coming out. But what we can see next is that their speech is not affected. It's very fluent speech, um, and it's often made up words or empty speech of just random words together. Um, it's prosody and articulation may be normal. Patients generally are not aware of their condition, which is kind of sad, and they'll become frustrated with others, just like maybe when, I don't know, maybe if you got your wisdom teeth taken out and your mouth is numb, you're kind of not you know what you want to say, but no one else is understanding what you're saying because your mouth is numb. So it's kind of like that, but there's no issues with the mouth. It's just their comprehension. So that would be really frustrating. An early clue to the Wernicke's aphasia is abnormal spelling. This is just kind of a little sample that I found, and I can't even tell what he's trying to say. Something about maybe ham sandwiches and um, maybe I don't know, something about a sandwich. But you can just tell that something's not right, and that does not make any sense. Some types of the errors, there's parasympathetic errors. They come in two forms. You have semantic paraphasia errors, and this is where one word is substituted for another word. So an example would be if a patient is saying watch instead of clock, that it's kind of the similar idea, but it's not really what they mean. Kind of another one would be if they're wanting something to drink and they say, maybe they're wanting milk, but they say Sprite instead. Like it's still something to drink, but not at all what they want. Um, then you have phonemic paraphatic errors, um, or phatic errors, rhystic, I don't know, where one sound or syllable is substituted for another. An example of this is when a patient might say doc instead of clock. So they're just substituting one of the sounds. And so once again, it's kind of similar to the word, but it means absolutely nothing whenever it's used in a sentence. Um, I think another example would be when someone is trying um, to say um, maybe cat. They're talking about a cat, but then it comes out rat. So it's like a whole different thing that they're talking about. Some treatment. Um, that they could go through. Currently, there's no standard treatment, but that's why we come in, is because speech and language therapy is the main care. Since comprehension is impaired, the patients might lack insight into their deficit, so they don't really understand why they're in speech therapy, which can make it very challenging to work with them, but they still definitely need therapy to help them be able to communicate. And some of the treatment plans goals would be to allow the patient better use in their remaining language function, improve language skill, and communicate in alternative ways that their wants and needs can be addressed. So you can teach them or continue to strengthen the existing skills of maybe gestures or eye contact. And then you can also look into using different devices like an AAC device or maybe pictures or maybe writing notes on a board or something, just another way um, to be able to get their point across. And that's all I have. Thank y'all so much for watching.